We'll ask the county council, are there any additions to the agenda?
Chairman, there are no additions to today's agenda.
Okay. At this time, we'll stand and do we have a pastor present? We do. Pastor Roger Leach. Southwest Christian. Happy to have him here this morning.
Thank you. Yes. Let's just bow our heads as we pray. Lord, we thank you that you give us words that are really appropriate for times like this. And in the New Testament, the Word of God says in James chapter 3, verse number 13, who is wise and understanding among you? Let them show it by their good life, by deeds done in humility that comes from wisdom. Lord, we pray that this morning for the Board of Supervisors as they meet in this special meeting, that you grant them wisdom and understanding. And Lord, I pray for unity, and not only in the board, but also within our county as we continue to do things that would be best. Lord, I pray for, again, the prosperity of our county, that you will continue to bless it. And Lord, during this time, we give you thanks for all of the rains that have come. But Lord, we also thank you for the people that work hard. And Lord, today we lift them up and we give you thanks for each and every one of them. And we pray these things in your name. Amen.
Supervisor Poitras.
I pledge allegiance to the flag of the United States of America and to the republic for which is one nation under God, indivisible, with liberty and justice for all.
Okay, public comment.
Public comment. The first 15 minutes of each regular session are set aside for members of the public to address the board on any matter under the jurisdiction of the board, but not appearing on the agenda. The board will not take any action on any items presented under public comment. Speakers are limited to 3 minutes. Anyone addressing the board is asked to print their name clearly on the speaker sheet at the podium and state their name and county of residence for the record.
Okay, we have a couple of members, community wishing to speak. Go ahead.
Blessings, everyone. Good morning and happy Valentine's Day.
Yes.
Today is a day of love for each and every one of us. And I just want to let you know I am Councilwoman Anita Evans from the District 4, City of Madera. And this Sunday, as you know, this is Black History Month. And we will be hosting, Black Saints United and the City of Madera will be hosting the Black History Month celebration. It will be at 3 o'clock at McNally Park on Sunday. And I would like to invite everyone out. Because guess what? It's not only Black history, it's American history.
Right.
And I'm good trouble. So I just want to invite you guys this morning. God bless each and every one of you and have a good day. Thank you.
Where'd you say what park?
Excuse me, it's at McNally Park,
McNally Park.
which is in District 5.
Okay.
Okay?
Mr. Chairman,
you.
if
Yeah.
I may,
Sure.
I'd like to acknowledge Councilwoman Evans, who has made history herself. She is being recognized and inducted into the San Joaquin African American Historical and Cultural Museum, and that's taking place on the 24th of February. And we are very excited and happy for her. And thank you for everything that you do to be a trailblazer.
Oh, thank you so very much. God bless each and every one of you. Have a good day. Bye-bye.
You too. Thank you for being here. Next speaker, please.
My name is Bob Casper. I've been a member of the community since 1975. I'd like to commend the council, the board rather, on revisiting the issue of the pay raise. I'll remind you that optics are important, that this pay raise,
Sir, if you would save those comments for the agendized item, I appreciate it. If you have other comments that are not on the agenda, the public comment is reserved for items that aren't on the agenda.
I understand. Thank you.
Okay, thank you. I'm sorry to do that to you. Anyone else to speak to the public? Anyone online? Okay, can we have them come ahead at this time? Person online, please.
Hi, are you able to hear me?
Yes, we are. Go
Hi,
ahead.
thank you. Thank you. My name is Sue O'Connor, and I just wanted to thank Bobby McCauley. During the last meeting, he pulled a couple items out of the consent agenda to put some more light on that, and I just really appreciated that action, and I hope to see more of that in the future. So just thank you again.
Thank you. Any other comments? Come ahead.
Good morning. DJ Becker, the Madera News. Here we are again. Let's talk about transparency. This is only a partial list of the questions I've received from residents and employees in the last week. Why does this Board of Supervisors and the administration feel that they do not have to answer residents' reasonable questions about their actions with taxpayer dollars? Live stream from the last video is still not available online. What has happened to all the previous years' online video archives? Residents and employees are claiming these actions are intentional, convenient, and more evidence of bad faith by this administration. Whose idea was it to implement the reorganization in 2022 and provide huge raises for county departments during a deficit year? What was the total financial cost of the many raises and reclassifications, and how was it paid for? Does anyone know? How much is the deficit? Why would Madera County Board of Supervisors decide to spend $60,000 during a deficit on a 3-day annual conference at Bass Lake? That included spa suites, food, and a speaker from San Francisco, especially when Madera County already has a conference facility like this right here in Madera. The Madera County, or excuse me, how were the $30 million in ARPA and COVID monies used? Were they used to cover budget deficits for the next 4 fiscal years? That appears to be the case. Why has the county refused to provide an independent audit for residents, employees, and bargaining units?
What again? Watch what? Again. What?
Madera. Thank you.
Madera Community Hospital was reportedly losing millions a year long before the COVID-19 pandemic. Why wasn't the Madera County administration more aware or more proactive in trying to save our only hospital sooner? Why was the recent campaign manager for Supervisors Robert Poitras and Brent Frazier recently appointed to be the director of Madera Economic Development in 2022? What experience or qualifications does he have for that position? Does he live in Madera County? Why has the Madera County grand jury not consistently had working email service for the last 5 years, or the necessary office supplies and equipment they needed to do their work? Residents also claim this is intentional. How many millions of dollars was the legal settlement for Constellation Winery? Why is that information being withheld from the public and not being disclosed when residents request it? How did the Madera County Assessor's Office end up being in court with an international company? Have the millions of dollars in Madera County transit occupancy tax collected from hotels and mountain vacation rentals ever been audited or publicly accounted for? And then we have another one that residents seem to really be worked up about.
Your time is up.
Thank you.
Thank you, Mr. Chairman. Matt Treber, Development Services. Just wanted to inform the public and the board of some good news, and kudos to Mr. Jared Carter up on the 3rd floor on his work in negotiating with Federal Highway Administration. With his work, they are opening up Avenue 26 to that contract when that road was all redone, and FHWA is going to handle the repair work as part of that storm damage. So wanted to give the board and the public, they anticipate, our latest communications with FHWA was they anticipate granite construction being out there on site hopefully next week, but no later than the end of the month, and get that road back open back up. So wanted to give the board and the public the good news on that one. Thank you.
Thank you. Next speaker.
Nice to see everyone this morning. My name is Brandy Curran, and I am a Madera County employee, 31 years. And I just wanted to say something today to all of you. I wrote it down so I wouldn't forget. As one of several county employees that have dedicated my career to Madera County, I remain dedicated to my community through the good times and the bad. I feel compelled to voice concerns not only of my own, but those of my peers regarding the passage of the salary increase. Sorry, I heard you get down here.
Ma'am, I have to stop you right there because that's an agendized item.
Okay.
If you wish to speak on the agendized item, you have to wait till it comes up on the agenda.
Okay, I can do that.
Okay, thank you.
Thank you. Give me time to catch my breath.
All right, any other public to address the board? Anyone online?
None.
Okay. Item 4.
Or
4A.
4A, Human Resources Department, Board of Supervisors Compensation, Discussion and Consideration to adopt a resolution appealing ordinance 701 and revoking allocations of the compensation and benefits provision for members of the Board of Supervisors identified in ordinance number 701. Discussion and consideration to introduce to approve an ordinance repealing ordinance 701 and reaffirming and reenacting ordinance number 530G pertaining to the compensation and benefit provision of members of the Board of Supervisors. Set the second reading for March 7th, 2023.
Good morning, Chairman, members of the board, Roman Noriega, Human Resources. Ordinance 530F established that effective July 1st, 2015, Board of Supervisors member or Board of Supervisor member or board member shall receive a percentage of a Superior Court judge's annual salary when they have commenced their 6th year of elected service. Ordinance 530D established that effective July 1st, 2002, the annual salary for a member of a board member would be set to a percentage of a Superior Court judge's annual salary. As of December 1st, the annual salary for Superior Court judge was $231,174. And the compensation schedule in effect and what is being recommended for today's action as set forth in Ordinance 530G specifically, the annual salary of a board member was and is proposed to be 41.2% or $95,243,069 of an annual salary of a Superior Court judge's annual salary. Additionally, when a board member commenced their 6th year of elected service, their annual salary would be 43.26% or $105,000.87 annual salary of a Superior Court judge's annual salary. At the Board of Supervisors board meeting on December 20th, 2022, the board approved Ordinance 701, which provided a 22% increase and a 28% increase commencing with the 6th year of service. In the compensation schedule for the board members, during the February 7th, 2023 board meeting, the board directed staff to schedule a special board meeting to rescind Ordinance 701. With the board's approval to rescind Ordinance 701, the board would continue with the current compensation schedule set at 41.2% of a Superior Court judge's annual salary and 43.26% commencing with the 6th year of service of a Superior Court judge's annual salary. Furthermore, it shall be at the individual board member's discretion to waive any future salary increase that would be effective under this proposal, under the proposed new ordinance as they so choose. The salaries for the members of the board shall be paid monthly or otherwise, all in accordance with the payroll procedures applicable to county officers and employees. Individual board members of the board may for any period of time waive the right to receive a portion of their salary by completing the appropriate documentation and transmitting these to the county auditor, controller, and Department of Human Resources. It is the staff's recommendation that the board's compensation schedule be included in the county's classification and compensation study that is currently underway, and any recommendations for change be brought back to the board for future consideration.
Okay, thank you. Just one quick question on that. So if this passes, it goes back to the original way it was. No changes with the exception of the ability to waive the raise. Correct.
Well, I believe, and I'll let county council try to answer this for me, but I think it needs to go to the second reading, be
Right.
published, and
Right.
yeah,
Yeah. If it's enacted, that's the way it would be.
correct.
Okay. So any discussion from the board on this item? Okay, if not, I'm going to move to approve item 1 and 2, set the second reading and for March 7th. And then if I get a second, we'll have public comment.
I'll second.
Motion is seconded. So with that motion and second, we'll have any discussion further from the board? Comment from the public at this time on this item. We had several ready to comment earlier.
Good morning. I'm John Perro, Wawani resident. I just want to thank you guys, take our hats off to you for this meeting to repeal the raise from December 20th. And thank God I can start taking my long underwear off from standing out and freezing my legs off, getting all these petitions signatures. Let me tell you, we've had thousands and thousands of signatures, which you guys know. And people have been pretty upset about it, but I just want to commend you for that. It takes fortitude to reconsider an item that we simply want to acknowledge that. And also a special shout out to Supervisor Gonzalez and Poitras for standing up tall and voting no on the original resolution for December 20th. So we trust that you will stay the course and ensure that any recommendations coming from the salary study are fully justified and free from the competitive comparisons for elected positions. I do have a couple questions. So if a yay vote for this repeals the ordinance 701, but my understanding is it has to have a second reading, which would be March 7th. So does this go into effect immediately or does it go into effect after the March 7th? And if that's the case, is there any possibility that there could be any amending on that March 7th?
It doesn't go into effect until it's voted on the second time. second reading.
Actually, Chairman, just like with the original vote on the raise, this particular type of ordinance has a 60-day wait.
Right.
John, so the actual effective date, I believe the calendar date is the 6th of May.
Right.
So,
Okay.
so it'd be read the
So-
second time on the 7th, effective May
Okay.
6th.
So since the effective original date of 701 was February 18th, if you vote to rescind today, hopefully you do that, what happens with the February 18th date? Is there like an intermittent raise or how does that in between this and when it gets, voted on the second time?
County Council, can you answer that?
Yes, Chair, members of the board. The purpose of the resolution is to also, if it's voted upon, to stop any salary increase that was set forth in Ordinance 701.
Thank you.
Now, the resolution might also have the effect of trying to prevent and repeal Ordinance 701, but in the best business, ordinances repeal ordinances, resolutions repeal resolutions. And so I hope that answers the question. There's no in-between period. The proposed action for today would set the salary as set forth in the resolution at 530G ordinance that was read into the record. So where it was in November.
Okay.
By making a budgetary action pending the legal ordinance process. There's no immediate repeal, even with a referendum that is verified by a petition. There's no automatic immediate way that an
Right.
ordinance can take effect. And by the California Constitution, it's 60 days to make this ordinance effective, which is double the normal ordinance for certain reasons.
Right.
Thank you.
Okay, thank you.
I was trying to get some answers on this yesterday and it sounded like it's pretty convoluted. So anyway,
Thank you for those
thank you
questions,
guys.
'cause
I hope that you make the decision to rescind it today and carry through on March 7th. So
Thank you very much. Thank you for the questions. That helps clarify some things that other people might have, questions that they might have. Go ahead.
Hi, Brandy Curran again. I just wanted to say, as one of several county employees that have dedicated. Oh, sorry. Okay, as one of several county employees that have dedicated my career to Madera County and have remained dedicated to my community through the good times and the bad, I feel compelled to voice concerns not only of my own, but those of many of my peers regarding the passage of a salary increase for our Board of Supervisors. Although I understand the need to review salaries and compensate accordingly, that offer was not afforded to dedicated essential workers employed by this county. Therefore, should not be afforded to those governing the county. As a supervisor, I have been trained to understand that you lead from behind. You, as a part of the leadership team, support staff while they do the essential work that keeps this county operational. Not only have raises been denied, but random salary adjustments, reclassifications, and a step analysis process had been implemented, still bypassing many of us who have worked tirelessly for this county. I myself, a 30-plus year veteran, was denied the opportunity for a step analysis when I was promoted in 2021, while peers that were hired in the same timeframes were offered salaries at a higher step than myself because of their hire date or simply because they were new hires. These new processes were never discussed with our representatives and were arbitrarily put into place. I implore this board, our representatives, to reconsider voting in a raise until your staff can be afforded the same. Thank you.
Hello, I'm still Bob Casper, and I'm a resident since 20 minutes more than I said before. I'd like to commend the board of
Your mic is not on now. Push the button. I think you touched it and
hello again. I'm still Bob Casper, and I'm now here for 17 minutes before I said before. Anyways, I commend you for reconsidering this issue. And I'll remind you of the optics that this issue was proposed in near secrecy at the last minute of the last board meeting of the last part of a tenure of a former board member who proposed it, and I'm referring to Mr. Wheeler, saying that this way, in effect, the public could have nothing to do with it, that it was set in stone, his words, and incidentally, while wearing what appeared literally to be some sort of costume, and just moments after celebrating residents' homes burning down. Now, I'm not sure if that goes to the substance, but it sure goes to the optics of this situation. When you have a situation where the self-service rather than public service is suspect. So going forward, I would suggest that what you need is credibility, a credible, transparent public process. I don't think it's sufficient simply to have a review by the Human Resources Department, because they are under your purview, they're under your control, they can be affected by your decisions. It should be at least more transparent than that. This is not a complicated issue, really. The data set is not a complicated one. It's not a data insufficiency problem. There is no complex methodology that need be applied to a complex data set. Actually calling it a study elevates it a little more than necessary. It's actually just a survey. So do the surveys, call them studies if you like, open them to public review, and then trust the public to be reasonable. Everybody needs to get paid, and costs are going up. But this is public service. You should avoid at all costs the appearance of self-service, which even to the inattentive, it appears to be. And I'll just remind you that the inattentive vote also. Thank you.
for your comment. Next speaker.
Good morning, Ron Montoya. I was watching a commercial, San Joaquin Valley Air District, and watched Tom Wheeler, listen to Tom Wheeler. Working together is better. Absolutely, for a board of supervisors in Madera. Absolutely. This type of rhetoric, slash and burn mentality, fact patterns go back years, David. And I'm not going to insult the real Mr. Rogers by calling you Mr. Rogers. Let's hope this is a reset button moving forward. It takes 4 votes to make real change. And by doing this, it shows that I think we're hoping to turn the page on Frazier, on Wheeler, and Rogers, David. It takes 4 votes. Public officials enriching themselves at the expense of others. This is exactly what you did on December 20th. Now, David, can you articulate the mindset, the thought process of you and Frazier and Wheeler 2 weeks before 700 people lost their jobs? I think the public deserves a comment from you. Now, we can circle back and kind of tit for tat X, Y, and Z, but this highlights a lot of things. It highlights there's some funds. Like we can all go and drive to Lavina and maybe we can all kind of drink a glass of tap water and just face the reality of some of our system inequalities. Why don't we all do that? Why don't we all take a walk over to the Madera Animal Shelter and cross paths with this understaffed, where dogs have no name, where cats have no name. There's money, there's funds. And hopefully you guys turn the page and do things for the community except for yourselves. It would be nice if Mr. Frazier would be here and take it on the chin for once, be a man for once. Now, would he give his employees a 56% raise? I don't know. It's a great question to ask him. But I think it's time to turn the page. It takes 4 votes from all of you guys. Now, if you guys want to go walk over to Lavina and, these county roads need repaving, let's do it. I'll be the first one to volunteer. I'll be the first one to volunteer to go to the Madera Animal Shelter and explore the living conditions where, like I said before, dogs and cats have no name. It's time to make some serious change, and that's why you guys are up there. Thank you.
Thank you for your comment. Next speaker.
Good morning, Mr. Rogers and the board. Thank you very much for repealing the raise. And a few more things. Please give today happy Valentine's Day. Thank you for not making love with our money. Go make love with your lovers. Thank you. I appreciate that. And yeah, please, hospital was closed down. It's for Mr. Poitras, my neighbor. Your hospital president CEO is still getting paid. Why? So this is another question. Few more things. When you give raise to people here in the county or anywhere in the government, please check the marketplace. No surgeon made over $200,000 in this town. So is your administrator, even county administrator, what's his qualification? Is he worth this much? Or are you guys worth that much? Think about it. Check the marketplace before you give yourself raise. Thank you.
Thank you for your comment. Next speaker.
Hi, my name is Nancy Harmelin. I have lived in Madera County at the same address in Ahwahnee for the last 50 years. And this is my first time at the Board of Supervisors meeting. And I'm so glad that you have above your heads "In God We Trust," because that's where we need to trust it. John Pero is a friend of mine, neighbor, and I helped him collect over the thousands of signatures for the rescinding of the raise. And thank you for your consideration for doing that. I think money can be better spent on police up in the mountains and also fire. That's already been addressed. And during the campaign, it was promised that, oh yeah, we're gonna put up more firemen and more policemen. And when I went over to Wachuma School, it's on Highway 49 in Ahwahnee. I've had 7 children graduate from that school and from Yosemite High School. And I noticed at that time there was a serious danger with the parents picking up their children and leaving them off. And it was a traffic hazard and a safety hazard. So I went over to the sheriff's department and I said, this is an accident waiting to happen and we need to have maybe flashing lights or a sign or something out there by the Highway 49 where the speed limit is like 60 miles an hour, but people don't read the sign of 40 miles or 25 when children are coming and going to school. And they said, well, we don't have enough policemen to provide that protection while the kids are being dropped off by their parents or picked up. And so she said, the sheriff said, go over to the CHP office across the street. And basically they gave me the same answer, that there wasn't enough staff and help to do that. So I'm hoping that you'll consider, instead of the raise, that you'll give us up in the mountains more fire protection and more police protection. Thank you for your time.
Thank you for your comment. Next speaker.
Good morning. My name is Gordon Kennedy. I'm a former member of this Board of Supervisors. I live in the city of Madera now. I lived in District 1 when I was representing the county. When I was on the board in the 80s, it was still what we considered to be a citizens administrator for the county. I don't think, and it had been that way for over 100 years. I don't think that there was ever any intent that this should be something to make a living off of. And I'm proud to be able to represent the county and still be in business, my own business, and not have to have been paid for my service while I was on that. Although we did, I received $1,000 a month. And that's about 12 times less than what you're paying now, being paid now. At that time, shortly after that, I think in the 90s, was when the salaries were started to go up, and it's continually gone up since then. And by attaching it to the Superior Court judge's salary, it gives this board the excuse that they are not setting their salaries anymore as we did. And during that time that I was on the board, at least twice, it were refused to take salary increases, even though we gave them to all the employees. But by tying it to the Superior Court judge's salary, you are abdicating your own duties to support, to pay, to do the business of the county and set your own salaries. Like I say, I don't think it was ever intended to be something to make a living off of. It should go back to citizen administrators. Now, we see on Facebook what is going on, and you have a lot of time to go to ribbon cuttings and to conferences and that sort of thing at the expense of the taxpayers of the county. I don't think that that was ever the intent of the Board of Supervisors in the past, over 100 years, as I indicated. I'm satisfied that you are now taking the information, taking the initiative to possibly rescind your action. I think it was ill-conceived to begin with. We have other things in the county that needs attention. What about the homeless? What about the ones that, the housing situation? What about the hospital? We've lost it. If you have money to make increases in salaries, certainly some of it could have gone to any one of those three items. I think that that is one of the drawbacks to ever have even considered increasing the salaries to such a point as
Time
it
has
is.
expired. Can you wind it down?
What's that?
I said your time has expired. Can you wind it down?
No, that's fine. I'm through. Thank you.
Thank you.
Good morning, Board of Supervisors. Gary Gilbert, also a former Board of Supervisors. And I would just add, if you're going to revisit your ordinance, and there's part of that ordinance, if you're going to adopt it as a percentage, that was set up for Superior Court judges. Superior Court judges do not have longevity pay. And if you did, and I would suggest before you revisit this, have your staff contact CSAC, how many elected officials, Board of Supervisors, or elected officials get longevity pay. Longevity pay for an elected official comes every 4 years. Thank you.
Thank you for your comment. We have one online. Sue O'Connor, go ahead. Can you hear me?
Can you hear me now?
Yes.
Oh, thank you. Sorry about that. Again, I just want to say thank you to the board for bringing this item back and to vote on it as the board that's seated now. I believe the intention of the previous board was to, according to a quote from Supervisor Wheeler, was to save you from messy business. However, as you know, you ran for an office where you're going to have to do messy business. And I really appreciate this board taking responsibility for the pay structure that you vote for yourselves. And I look forward to seeing who votes yes to rescind. And I appreciate, if it passes, that you will save us from a referendum, because we had thousands and thousands of signatures that we gathered in about 2.5 weeks. This is something really important to this community. Thank you.
For your comment. Are there any other public who wish to speak at this time? If you want to speak, please come up behind this lady and sign in if there's any more. So, but thank you. Go ahead.
Board, residents of Madera. I wanted to thank Supervisor Gonzalez, Supervisor Poitras in the last meeting to bring it up for today's special meeting to repeal the raise. I also want to thank the 2 new supervisors. That board had the moral compass to do what's right, and that is repeal this raise. Supervisor Rogers, Mr. Montoya brought up a good question. I don't believe you answered it. Can you speak to the gallery and justify the raise? I think we deserve that, sir. I hope we get the hospital back. That's my thing. I want our hospital. Madera needs a hospital. Thank you.
Any other public comment? Go ahead.
I'd like to come. My name is Martha Robron. I've been a resident since 1995. I'd just like to comment on the indexing of the salaries to the Superior Court judges. The judges are full-time positions. They require a great deal of expertise and experience and education for that position. When you index a position that's supposed to be part-time and requires absolutely no experience to get elected, then that seems completely inappropriate. So I would suggest that you find some other way to decide what your salary should be and not compare it to every county in the state, like Los Angeles, San Diego, Santa Clara, San Francisco, Sacramento, which do not have the same demographics that we have in this county. Thank you.
Thank you. Any other public comment? If not, I was asked a question, so I'll gladly answer it. It takes a vote of 3 board members to put an item on the agenda, special meeting. I also have an option as chairman to call that special meeting. We didn't have a vote of 3 supervisors. I called the special meeting as chairman. I just made the motion to repeal the ordinance. My colleagues seconded it. That's my answer. Thank you. Is there any other comment from the board?
Mr. Chairman, I have a comment,
Go ahead.
and many of you might think this is a non sequitur. It's like, what does this have to do with the topic? But there was an individual, I'll make the nexus. There's an individual who came up here for a public comment and mentioned the "In God We Trust" sign back here. And it occurred to me that the individual who is primarily responsible for that "In God We Trust" here is actually here in our presence. And I bet you that 98% of you have no idea who that is. Well, I'll let you know who it is. It's Pastor Roger Leach right over here, who led the effort to help. Yes, thank you. So anyway, I just want to thank it was back, 2014, 2015, something like that. We got that in the Madera City Council chambers as well as here in the Board of Supervisors. So once again, thank you, Pastor Leach. And that's the nexus to the public comment. Thank you.
True. And that was a great unanimous vote by this board and the effort led by Roger Leach. We believe in that, and that's why it sits behind us right now. Kind of reminds us from day to day what we do about duty. Thank you. Okay, so we have a motion and a second, and we'll ask for a roll call vote.
Chairman Rogers,
Yes.
Supervisor Poitras.
Yes.
Supervisor Wamhaugh,
Yes.
Supervisor Gonzalez,
Yes.
Supervisor McCauley.
Yes.
Vote passes 5-0.
Okay. All right, so we'll go to item 4B.
Item 4B, County Administration Department, hospital closure. Discussion and approval of letters to the state of California regarding the healthcare crisis in the Central Valley and to Madera Community Hospital Consultant Engagement. Update on healthcare provisions in Madera County.
Good morning, Mr. Chairman, members of the board, Joel Bugay, County Administrative Office. The first recommended action is requesting your board authorization to send 2 letters. The first letter being addressed to the governor and the Secretary Galley of the California Health and Human Services and Attorney General Rob Bonda, urging the governor and state officials for policy interventions that would help make the healthcare delivery environment in the valley easier. Specifically, 3 proposal requests. 1 is to revisit a Medi-Cal reimbursement floor and setting it in a floor that would help alleviate some of the revenue concerns for rural hospitals. Second is the possibility for grants that would be available for struggling rural hospitals like MCH or something that would have helped MCH early on prevent from closure. And third is some sort of revolving fund of no interest loans that help bridge the funding gap as struggling hospitals like MCH experienced during the pandemic and during surges. The second letter staff's recommending the board send is a letter to Madera Community Hospital requesting full access to the hospital's data and staff for the county's consultants so that they might conduct a detailed review of operations and finances going back 5 fiscal years, covering making sure to cover pre-pandemic fiscal years. The goal of this proposed review is so that we could quantify the systemic issues that have plagued rural hospitals like MCH in the hopes of providing actionable proposals to state administration and legislative leaders. County staff also believes that the information gleaned from this review can help both MCH and the county as we partner in restoring or reshaping hospital healthcare delivery in the community. The second recommended action is an update on the healthcare delivery, and Dr. Paul will provide an update on that.
Go ahead, Dr. Paul.
Morning, Chairman, members of the board, Simon Paul, Health Officer. Wanted to give a quick update. I'm going to be focusing on the care of the patients, the people who are cared for at Madera Community Hospital. Obviously, there are also impacts on the economy and the people who work there. But as far as the patients who are cared for there, starting at the healthier end of the spectrum, people who are in primary care, there are about 7,000 patients, I believe, cared for at the rural healthcare centers there. 6,500 or so of those have now been absorbed into the Camarena system, and they're currently scheduling patients for primary care appointments and have been able to onboard some of the primary care providers who used to work in the rural health clinics to work within their system. Camarena has also been able to get HRSA approval to provide specialty care within their system, and they've are busy onboarding those people, starting with infectious disease, pulmonary. In addition, they've also hired 2 urgent care doctors, and they're adjusting their urgent care hours to meet basically the hours when they're seeing most demand. So on the one hand, well, 2 things. So first of all, we're incredibly lucky that there's a system large enough to be able to take on that many primary care patients and adjust to include specialists in their care. So that's a huge plus. On the other hand, it is not simple transferring thousands of patients from one system to the other. I'm certain there'll be people who have troubles with that transfer, start to fall through the cracks. Again, usually the people with fewer resources. And we in Camarena can work, and the Anthem and Calviva as well, to try and help people stay in care. On the other hand, the other thing that's important to remember when we're trying to come up with models for possibly reopening or reestablishing something with Madera Community Hospital, rural health clinics were clearly an important part of that system. And every month that goes by, people who used to get care are now establishing care with other organizations. Providers who used to work in those locations are now signing contracts to work for other organizations. So it does make the options for the Madera Community Hospital site change, obviously, over time as these patients are incorporated into care elsewhere. That's at the healthiest end of the spectrum. At the other end of the spectrum, people who are sick who obviously immediately need 911 care. I've talked before that EMS has done an amazing job of stepping up. Historesi, Sierra Ambulance, and American Ambulance trying to provide coverage with very short notice. And they've actually done quite well at that. If you look back in previous months, there are about 420 people who got transferred to Madera Community Hospital. In January, about 140, obviously none went to Madera Community Hospital in January, about 140 of those went to St. Agnes, another 140 to Community Regional, and about 40 went up to Mercy and Merced, and a few went to about 10 to CCMC. And so again, by having a plan, the good news is they've also been able to do this without a change in the response time. The response time for priority 1 and 2 calls, the sickest patients is still, it's actually down. It's just barely by a few seconds below 9 minutes. It's usually about 9 minutes and 10 or 20 seconds. There hasn't been a big increase in response time. And even for priority 3, which averaged about 13-minute response times, those also have not changed. So that's the good news. Again, the bad news is we're doing a great job transporting people to Fresno, but there is no space at the hospital in Fresno. They're all above capacities. This is a significant strain on their system. And also EMS is able to do this by sort of pushing the limits a bit, and you start to see stress in the cracks with fire stations being asked to help out more. And it's just, like I said, it will take scaling up at a significant level to be able to keep this increased level of EMS response going in the county. So then what about people in the middle? And actually, if you look at the numbers that I mentioned, if you did the math quickly, you will see we used to have about 420 transports to Madera Community Hospital, and about 350 are now being distributed around Community, St. Agnes, and Mercy. What happened to the other 50, 60, 70 patients? It's hard to know because it may just be seasonal variation. 400s might have been during a surge. There might have been more people being transported. But on the other hand, it clearly shows that one concern that people had before has not come to pass. One concern is people who did not have transport to get to Fresno, who could have gone to Madera Community Hospital, would just call 911 to get there. And there would be a big increase in calls to 911. We are not seeing that. If anything, there are fewer calls total. And if you think it through, people probably are reluctant to call 911 just for transport to get to Fresno, because how are they going to get home? It's not a trivial thing to call 911. Yeah, there may be some people who use it who could have found another way to get to the hospital, but in general, people are pretty reluctant to call 911 for an ambulance. We are seeing fewer people being transported, not more, which I think brings me to the people who are the most effective, which I mentioned at one of the prior meetings, which are people in the middle. They're not just needing primary care. They're not obviously taking an ambulance immediately to the emergency room. It's people with heart failure that needs fixing, diabetes that's out of control, who really need to go to an emergency, but they don't necessarily have to go by 911. And those patients are much more likely, if they're leery of going to Fresno, if they're not used to traveling to Fresno, if they don't have resources to get to Fresno, to delay care, to show up later. That may be part of the reason why you're seeing fewer people going by 911 to Fresno, because these people think that they're not sick enough to go, so they do not call an ambulance to transport them there. But it's also very hard data to get because it's easy to measure our ambulance transport time, response time. It's easy to measure how many people are in primary care, but it is not easy to know how many people would have gone to the emergency room for their diabetes and now didn't, or maybe going 4 or 5 days later. So I think there's still a big gap for those patients, like I said, in the middle, who really need emergency room level care. What can we do? What are we trying to do during this time while options are being considered? What can be done with Madera Community Hospital in the future going forward? Right now, we're working basically to try and help as many people stay in care as possible. For people to enroll in care, now is not the time to delay getting enrolled in care, right? There's support out there. Medi-Cal, Anthem, Calviva are providing transport to distant appointments, but you have to have Calviva or Anthem. And like I said, it takes time to get into those systems. So helping people learn those options, helping people know when they need to go to an urgent care, when they need to go to an emergency room is important. Also, with ending of states of emergency, both federal and state, many people will now have to recertify for Medi-Cal. And the hospitals have also asked for help with that because they do not want people losing their coverage and showing up in the hospital. So we'll be working with DSS to try and roll out a plan to educate people who are at risk for losing their Medi-Cal to try and stay enrolled. Just two other things randomly that had come up before 5150s. There used to be about 40 per month. Almost that many are still occurring. About 13 went to St. Agnes in January, 11 to community, and 9 thankfully went not to the emergency room, but to the psychiatric stabilization unit. Those are a big burden on the system. Talking with the prisons, they are now transporting many people to CRMC. And I think it points out how critical the issue at CRMC is the lack of space. Their biggest issue with that is they just don't have space for the 2 deputies that come there. The emergency room is so crowded and so busy. More people you have standing around just makes it harder for the place to even function. So I think that feedback just made it clear to me how really stressed the system is. In Fresno, we're doing a good job with trying to find places to go, but there's just not the resources there to take on the patients that are being transported. So far things are sort of holding together. My biggest concern again are these people who are in this middle range. It would really be an emergency room. They're going to postpone going. I think we've done a great job with primary care, trying to get people that's still within the system. And EMS has done a pretty amazing job with the sickest patients, getting them at least to the hospital in time. So that's my update. Happy to answer any questions.
Yeah, I would suggest to people, if you need emergency care, to dial 911 and do it. I know of a person who, farm worker who both legs were broken, crushed by a tractor that moved forward. And they drove, they waited for their family. They drove them to the hospital. By the time they got there were some really serious complications, had developed some clotting and real problems. So my comment to the general public, my advice would be call 911 if you have an emergency. Don't hesitate. And I'm sure glad to hear about these response times, and I want to extend my gratitude to Pistresi, American, and Sierra for stepping in the gap. Certainly is beneficial to our community. In these letters, I'd like to see us CC the letters to all of our representatives, make sure that they're all aware of what's going on. And my comment to our representatives and to the governor has been very simple. We've gone from an underserved community medically to unserved community medically, and that's unacceptable in any society. I want to point out too, you know, that there's a lot of comment out there about this, and this was not under the purview of the Board of Supervisors. I want people to understand that we didn't operate the hospital, and even if we did, this isn't really a problem. This is really not a problem of the hospital governance. The people that operate that board and everybody involved there did what they could do. This is a perfect storm of circumstances that is coming down statewide. In fact, it's almost on a national scale, and you're going to see more and more hospitals drop. This is not the first one, and it won't be the last, because there are going to be more and more of this go on until our governors and people that can change this, the Attorney General, you know, he put forth some unacceptable information, and it cost the sale of a hospital. So, I mean, they need to think about unserved versus underserved. I mean, where are we at? Did it help? He put in his comments, he said, well, if this was sold, they're not going to get the service that they need. Well, where's the service now? We're not getting it at all. So I don't see how those comments helped. And it's sad to me. But I appreciate your report, Dr. Paul, and I appreciate everything you're doing to help this circumstance. Any other comments from board members?
I have a comment.
Okay, go ahead.
Yeah, thank you. Thank you, Dr. Paul. Thank you, Joel. I will say that we've had some meetings with our representatives with Assemblymember Soria and with Senator Caballero. That seemed very encouraging. They are in fact trying to tackle the reimbursement rates and the provisions set forth by the Attorney General. So that seems encouraging, and it is going on
Good.
across the state. So they have allies in the legislature that
Thank you for
that are
that.
working on that. So thank you to Supervisor Poitras for the other meeting the other day with Assemblywoman Soria. So, but just really encouraging. I think the one missing component is that, and I don't know if it's the county that wants to tackle this or we work with the hospital's administration, but to amplify the efforts that are happening, because there is in fact a group of people who are working on trying to save this hospital. And I don't think that that is being shared with the public enough. And so because there are several folks who are working on it. So maybe that's something that we need to work on. Thank you.
Excellent comments. Thank you, Supervisor Gonzalez. Appreciate that. And I appreciate Supervisor Poitras's efforts too. He's been in on this from the beginning, banging on the doors, banging on the legislature and on the governor and the Attorney General. And of course, we have to have some cooperation there to get it. So $200 million is no light debt. So.
And just to add, I think that's really important, the point. First of all, yes, statewide hospitals have lost huge amounts of money and huge numbers of them are losing. But public should know, if you need to get to the hospital, if it's an emergency, you will get in, you will get care. Yes, they're stressed. Yes, they're crowded, but just like during COVID, when things were full,
Right.
you needed something, they still find a way for you to get it. So don't delay calling an ambulance. I think that they'll come in the same amount of time. They
Right.
might be working extra hours, but they will
Yeah.
get you to the hospital,
Right.
get people the care they need.
Thank you, Dr.
Cool.
Paul. I
Thank you
appreciate
all.
that. Yeah. You have a comment?
Yes, thank you, Dr. Paul. My concern when this hospital closed was response times, especially when considering if our ambulance drivers or deputies are out of service, taking people out of county. So it is encouraging to hear that those numbers have not changed drastically, or if they have changed, it's to the decrease. But I wanted to ask you about how these are broken down. So you did say priority 1 and 2s are just under 10 minutes and priority 3s are about 13 minutes. Is that strict, or is that the entire county of Madera, or is that broken up into different segments? And
Yeah, I believe that's for Madera completely. It's all responses from Madera to the hospitals in Fresno.
okay, now is Madera broken up into different segments as far as what is a more
More focused on like Madera Community Hospital impacted area, well, because presumably the foothills area didn't change that much. With their
No,
response time
I'm
to
concerned,
people.
are different parts of the county more acceptable, or response times for different parts of the county more acceptable or not?
I haven't seen that
How is that
data. We
judged?
can ask EMS about it. My sense, probably not. Basically, their plans are like, if what you mentioned, ambulances are out of service. So if it looks like their ambulances are going to be out of service, American Ambulance moves in a backup ambulance to a station here so that if there's another call, there's an ambulance there to answer it. Because of that, actually, they aren't needed that often, but if they are there. So most of the calls are still being handled by Pistoresi and Sierra, even though American Ambulance is doing a lot of this backup stuff and doing more transports. They aren't having to do a ton more transports. They're mostly doing the backup. So most ambulances are moving from the stations they used to be. And it's not like responding to this area, this part of town, which I think might be what you're getting at. The ambulances having to come all the way from Fresno to get to there. And so that part of town would have a really long response time and might not see that in an average ambulances. But I can check with EMS. They have pretty extensive data, and I think they can do it by different ambulance services like that. I don't know how they could break it down, but they might be able to get specific areas if one area is offsetting the average and that area is doing it.
Okay, I appreciate that.
Well, go ahead.
Oh,
Sorry.
Because by and large, I was really focused on are people in the city of Madera getting faster response times than people in other parts of the county, et cetera. So if you could.
My
there's a way
guess
to
is it's
gather that
pretty,
data.
there probably hasn't been a significant change to one area. So here is going to have a much longer transport time, but not a response time, right? So if you're in Madera Community Hospital, I think they're responding from the same sites. And if the 2 ambulances are out of service, like you said, then an American Ambulance would back up. So it'd still be the same kind of response time. because they're not out of service because they provide the backup. But yeah, when you're picked up in Madera, you now have a much longer transport time. Now you're going to Fresno as before you just went around the corner to the hospital. But I can check. I think they can break that data down.
Okay, thank you.
I have one question. I know at one point, for reimbursement for ambulance transport was extremely low. And it was a problem for some of the ambulance outfits. It was jeopardizing their ability to operate in Madera County or anywhere for that matter. If you could look into that and find out what the deal is on that, and if, or maybe you already know, I don't know.
No, I don't, because obviously this has been done, but it has not been done for free, right? They
Right.
need to buy 2 more ambulances. They need to hire 4 more paramedics. So there are definitely costs, in the short term, they can do it by just having everybody work overtime and moving around. But in the long time, to provide the same turnaround time, the same response time, we will need more ambulances, more staff, or
Right.
EMS. The good thing is it's clear what is needed, right? Ambulance
Yes.
staff. Whereas for the hospital, I mean, replacing it, yes, would solve the problem, but it's hard to know, well, what about these middle group people? What do they need to get them into care? But for ambulances, it's clear what they need, but the cost, yeah, I can try and get.
Yeah, it's
Estimate.
scary, the thought of not having them, which are the stopgap. They are first responders. I mean, and in some cases, it's critical, the timing, as you're well aware, if a person has a stroke or a heart attack, immediate care is just absolutely a necessity. And so it's scary, the thought of not having them there to pick up the gap.
One
Go
other
ahead.
thing I didn't mention too is it's not just EMS, also fireworks, obviously with ambulance system
Sure.
effects on them as
Yeah, and we've been providing with our fire services, they've got new vehicles, they've got new equipment, good training. Even our sheriff's department has newer equipment and training for specifically for some medical responses as well. So,
fire staff can go with ambulances, hospitals. So those people can also be out of service, fire stations,
oh, that's true. That's true.
effects and other.
Right. Joel?
Yes, Mr.
Go ahead.
Chairman, I just want to add on the reimbursements for the EMS. So the county does have what it calls a reimbursement for dry runs for our EMS providers, specifically for the purpose of, that threshold of it's hard to provide. So that doesn't necessarily exist in other counties. That is something that the county does. So there is general fund that flows through DSS for what they call as dry runs. So if there's no insurance billable, there's a reimbursement from the county for that.
Okay, good. And can you check into that for us, see what the thoughts are? I mean, I don't want to double up on both of you, but just maybe Joel, you have access to that, and go ahead and check on that just to see what it is and if it's adequate. And
We work together with public health and looking
okay,
at this.
that's
anyways.
great. That's great. Thank you so much. I'm trying to prevent a problem even further expanding itself. So I just wanted to bring that up.
Mr. Chairman, if you will, I kind of want to clarify your comment earlier.
Yeah.
In the letter to the governor, the legislative delegation is already included as a copy. We just want to
Okay,
clarify
I just
if
missed that. Yeah.
if you
thank
would like to include the legislative delegation as a copy on the MCH letter or just on the governor's letter.
It's up to the board.
I think from staff's perspective, the letter to MCH is a cooperation letter.
Yes,
I think
yeah.
we would recommend not including
Yeah,
the,
I don't think so either. Yeah.
just wanted to clarify that.
Thank you. Thank you for your comment on that. Appreciate it.
Sharon, just a couple more
Go ahead.
questions. I know we've been going here for a little while, but Dr. Paul, when we had done the physicians town hall a couple weeks ago, you had mentioned that the digital exchange was going to be something that was very important to, I guess, continuity of care. Is that process still underway, or have you guys?
Yeah, they're working on it with Madera Community Hospital, and actually they're trying to figure out, there probably isn't a cost to it. The digital exchange is willing to transfer the records, one-time thing to the patient exchange, FedEx, first name. So yeah, there's been 2 meetings so far, and it looks like they can do it. The first meeting, they figured out how, and the question was, what would the cost from the medical record provider for their community hospital? Sounds like they're actually willing. Now they're trying to figure out if there isn't a cost, just how it happen.
Okay.
Again, that's so, and actually we may also be able to get Cameron onto that exchange because they're not requiring primary care practices to pay to join the exchange. And as more patients in Madera are getting care in Fresno, it's important that the doctors in Fresno are able to see information about their prior visit there to get them the best care. So that's moving ahead with Madera Community Hospital, and there may be other options. Cameron and even the health department to be involved in the.
Okay, thank you.
Yeah, I do want to thank Camarena too. We should have said that earlier. Camarena has really stepped up with their urgent care facilities. Without them, we would have nothing to go to in Madera County. And for some people, that's a great help.
Yeah. Losing a hospital, it's almost guaranteed you're going to lose specialists because that's where they practice. And the fact that we've been able to keep office hours visits for specialists through Camarena system, incredibly fortunate. We are, and it's just, we've got to somehow get things back in order.
And
back in the
CAO
right
Varney,
direction.
in regards to Dr. Paul's concern on people delaying to go seek care, is that something, from the public information team that we can be proactive with, just, encouraging people, don't delay, go today kind of thing, or?
Yeah, we did that previously during COVID because that was what was happening then. People were afraid to go to the emergency room. They'd wait till they were so sick that they did require hospitalization for non-COVID issues because they didn't want to catch COVID during the event. And just to reiterate what some other folks have said, if you think, just like calling for law enforcement services, if you think you need medical care, you're better to call 911 and have them tell you that they cannot transport you for a cut finger or whatever your issue is, than to not call and self-transport if you're not trained to care for the person that you're transporting.
That's right.
Always call first. If there's certain situations where they have to send someone from out of the county to transport you, or maybe even make other arrangements to connect you with the ambulance, better to find that out than to try to self-transport when you're not trained or used to doing anything like that.
Oh, that's a random other thing you made me think of is Lifelight is also on call for any, like if there's a traffic jam on 99, they're always a backup for if any of the EMS providers think extendedly delayed transport.
And then Chair, the last thing I have is I just wanted to kind of echo Supervisor Gonzalez's comments in regards to kind of leading the charge on this effort. I think there's a big opportunity for Madera County to lead the way, not just for Madera County, but for the Central Valley as a whole, because it is, we are part of that hospital system. And this is just, the tip of the iceberg as far as this issue goes. So I don't know if there's anything our consultant can do to be engaging with our neighboring counties, but I think it would be beneficial if we can think about how we may include them in any research or studies that we're doing. And I see you back there, Tony. Thanks for waiting so patiently.
Perhaps in the future, we could do a joint county, like a hearing here with Merced and Fresno, since there are partners in sharing facilities per people. I know they are suffering as well. So it's a mutual problem. And I know there are small counties who are fixing to just like, I think San Benito announced not too long ago that they were having issues. And then I think there's a total of 11 right now that are looking at
And
problems.
some of them are larger as well. They're not
Yeah,
just small
some of them are
hospitals,
larger
but
than
big.
rural areas. That's true. That's true. Well, thank you. Any other comment from the board? Then we'll take it out to the public. We'll have public comment at this time on this item. Go ahead.
Members of the board, my name is Tony Ward. Thinking, what's he doing up here again? And I'm older and it's very sensitive to me.
Yes.
When I was planning commissioner for Supervisor Gilbert, we had addressed this quite a bit and we had a plan. And let me just say, I don't want this to sound demeaning, but you are experiencing in Madera and Chowchilla what the Eastern Madera County has been experiencing from the very beginning. And how do we look at that? Or I can say those things. When I first moved here to the mountains in 1989, we realized the medical facilities were terrible. And so my wife who retired from Kaiser, administrative secretary, knew the ropes how to get things done. And so she and I presented to Kaiser the possibility of putting a facility in Oakhurst, which is really the stabilization of that area right now. It takes care of an awful lot of people. At the time I was commissioner with Supervisor Gilbert, and not talking behind his back, I'm commending him, because we had looked at how do you put a stabilization facility in eastern Madera County to cut down that travel time that you've all been talking about. And Madera is half of what our travel time is when you're going to Fresno. Madera County, eastern Madera County has not had any service from Madera County as far as hospital. We look at Fresno as our hospital facilities. We go to Kaiser, we go to all the other hospitals down there. We'd like to see Madera, the Board of Supervisors, put together an ad hoc committee to look how Madera can be independent. The residents who pay taxes here, want to live here, don't have to move when you get age 55 or older. They have to move. A lot of our friends are living in Fresno just to get closer to the hospitals. We need something in Madera County. And Madera just relied on everybody else except down in Madera and Chowchilla. Now, I hate to see it shutting down. It's terrible, but it's brought together everybody talking about the problem in Madera. And I'd like to see the board who said, well, it's above and beyond us. No, put together an ad hoc committee. Now, just my wife and I got Kaiser into eastern Madera County. If we could do that, what can you guys do? You can work together to put together something like they've done in Santa Barbara. I have a home in San Ynez Valley. Chowchilla Hospital has a stabilization facility in that area. We pay extra in a service district to make sure that that's going all the time. This is just an idea of what can be done to satisfy everybody in the county. So I just want to throw that out there because for us older people, and I'm older, I have a choice right now. Do I did that 55 minutes, the 40-minute drive, or do I move?
I hear you.
So I just pass that along. Thank
Yeah.
you.
Just to correct you, I didn't say it was above and beyond us. I just said we had nothing to do with its governance. And that's all I meant. We, maybe I phrased it wrong too. It's
Well,
possible.
again, maybe
But I agree with you. I agree with you. We need to do something about it. And that's why we're engaged right now. And we want to have something.
Take the initiative, put together an ad hoc committee that says, hey, we in Madera County have to address our population and take care of it, not rely on supporting counties.
I agree.
Thank you.
Thank you.
Hey, John, I just want to make sure you heard what Tony said there, though. He said we may need to pay extra. So he said it first, not us, okay?
That was the idea we were going to do. And when I ran for supervisor, Mr. Gilbert and I, Supervisor Gilbert, had already planned a service district for a site at Road 200 and put that in the plan. We had talked to community
Visionary.
hospitals and had it all going,
Visionary.
but it went away. But anyway, yes, a service district, I think the seniors would go with paying a little extra to make sure they cut down the travel time at least half, which may save their lives.
Right.
Thank you.
Thank you very much for the comment.
John Farrow, I'm not picking on you guys, so, but I just want to make this is an example of the politicization of medicine, okay? So we're dealing with a problem now because of one thing. I remember I sat through that meeting on, I think it was the last part of December, the emergency meeting you guys did.
Right.
And the one thing that stood out really strong for me is one of the speakers said, 20 years ago, the high percentage was private payers. And then they said, now most of the money is Medicaid, which are making pennies on the dollar. And the thing that flies through my brain was, yes, socialized medicine.
Right.
So I know, I'm assuming we all know that socialized medicine is not what it's geared to be. So we're dealing with the effect of that, just like we're dealing with the effect of all the state mandates where trash and roads and everything else. But one of the things, and I was thinking, I saw a headline the other day about Britain is now moving from 19% to up to 25% of their people are going back to private healthcare. What I was wondering, outside of putting together a solution for this, is can we as a board write or draft anything or any kind of letter or any kind of message to our both state and our federal representatives that we don't want socialized medicine, doesn't work. And just, to kind of emphasize that, because we are suffering the consequences of that right now. And as you mentioned, this is only one of many rural hospitals, and not even rural, that are threatening or being forced to shut down. So just an encouragement to maybe we could draft something together. Maybe it'll help a little bit or whatever, but.
I think our congressman takes that position as well. So that's
Right.
unfortunate. They're.
Yeah, I know.
In
It's
fact,
like,
both of them.
I know, we just
Both
need
of
to,
them.
need to talk to a few of the higher ups. okay?
Yeah, exactly. Thank you. Thank you for your comment. Any other public comment? Hearing none, this was an information item only, and so no action necessary. Thumbs up on the letters.
Chair, I just had
Oh, we
a
did?
quick question, actually.
We can do that by thumbs up.
I'll make
Go
a
ahead.
motion.
Yeah, and I'll second, but the question I have is in regards to the ad hoc committees. I know back in December, I think we had talked about putting together some committees to kind of oversee this process. And I'm not sure if that's still in the plans now that we have a consultant, but just checking in there.
CAO comment?
Yeah, I'm trying to get my mic turned on here.
Okay.
So at this point, the county has been focusing on where we should focus our energies related to revenue production. I think the point that we would form an ad hoc committee would be upon response from the hospital to the letter, because you'll better know what it is the county's in for and what everyone's in for. We've done our best to try to keep everyone in the loop with what we're doing. That includes our elected representatives, mostly in Sacramento. We've talked a little bit with our elected representatives in Washington, but not in depth. We are meeting with Congressman Duarte within the next couple of weeks, just to give him a heads up on that. And I noticed on the letter, there was a couple people we needed to add: Senator Alvarado Gil from the state and Congressman McClintock to the letter. But once we have some level of response from the hospital, then I think that's when we need to decide what we're going to do with an ad hoc committee. There's a lot of directions this whole thing could go. One was mentioned today with what do we do for the mountains, and what level of fundraising could be produced, say, in a healthcare district. It's not as much as you think it is, unless you go really heavy, and I don't think anybody really supports that. So again, going back to a presentation we did previously, just in the 3 main zip codes that feed people into the Madera Community Hospital at $250 a year, that generated about $5.5 million. So I think that would be one of the questions the ad hoc committee needs to deal with. What are we doing in the valley and what are we doing in the mountains? Are they totally reflective of each other? Or are they totally different? So we haven't done it yet, but that doesn't mean that it has fallen off our radar. Staff didn't believe it was time quite yet.
Thank you, Jay.
And we'll keep that on our.
Mr. Chairman,
Thoughts,
I'd
yes.
just like to add in, so what Jay was saying is waiting to hear what the hospital is going to do. Hospital hasn't filed bankruptcy yet. So that has not occurred. It could occur any day, but it was supposed to happen back on January 3rd. And the message there is the hospital is still working very, very diligently to put something together, an operating model that works, that would work under the current reimbursement model. The thing that really killed the hospital were traveling nurses, and besides the low reimbursements, without the traveling nurse issue, the clinics were profitable, surgeries are profitable, but the ER, which is
Yeah.
interestingly enough, the thing that we really want and need was a huge loss, as well as the ICU, because most of those nurses occupying those duties were traveling nurses. So it's the economics trying to work through that. Again, it's at some point, the hospital may be forced to file, but it's still working. So I think until that happens, it's going to be a little bit difficult to move forward with a plan, but things are still in the works.
Thank you for that report, Rob. That's great. And I know you're on top of that, so that's good to hear. Yeah, I appreciate, I just want to say that I appreciated Supervisor Gonzalez's comments earlier. Sometimes I get irritated with some of our representatives and I come down on them and I'm not plugged in with them, and she is, for various reasons. I'm not plugged in with them, probably due to political differences, but I appreciate the fact that you're engaged and what you said, and I should emulate a little more of that. Even though they might be from a different party, I need to engage with them, and I appreciate you reminding me of that. So anyway, thought I'd bring that up. We can learn something from each other, right?
Yeah,
any-
just
go ahead.
take, our legislators, they're doing what they can, because you think about it, what legislator is going to want to have their hospital closed in their districts?
Right,
And they're working diligently and working very hard. But you have to look at Sacramento. You've got a legislature, you've got the state Supreme Court, and then you have the administration, just like our federal government. And a lot of times the legislature has a hard time working with the administration and vice versa, and piercing that veil. So they are working very, very hard, and but like what we face a lot of times, it's working, like with Caltrans, our local district, we have a great relationship with, but then when you go to headquarters and you have kind of a different philosophical bent in terms of what transportation means, then
Yeah, it's like a stone wall at that point. Yeah.
exactly.
Yeah, I get it. Okay, any other comment from the board? We do need to vote on this motion. We have a motion from Letty and a second from Robert. Let's roll call vote, please.
Supervisor Gonzalez?
Yes.
Supervisor McCauley?
Yes.
Supervisor Wamhaugh?
Yes.
Supervisor Poitras?
Yes.
Chairman Rogers?
Yes,
Vote passes 5-0.
thank you for the unanimous. Any staff reports from any supervisors?
Happy Valentine's Day.
Happy Valentine's Day. And CAO, anything to report?
I just wanted to update the board a little bit on the fact that you previously approved the county to apply for a grant specifically related to doing a crisis stabilization unit in a sobering center. It has been submitted and the state has acknowledged receiving it. So we'll see if they fund, and if they fund the whole thing, that would be fantastic.
Great, thank you. County Council,
No report. I'll save it for the next meeting.
great, thank you. Karen and Clerk,
Nothing to report. Thank you.
thank you. Okay, with that, this meeting is adjourned. Thank you.